Okay, guys, I'm going to do a quick ask me anything. So go ahead. You got me for the next 20 minutes, 25 minutes. You can ask me anything. So you can ask me anything about weight loss drugs, weight loss surgery, really anything. This is not medical advice. So just go ahead. Go ahead. So I'm going to be here doing an Ask Me Anything about medications, surgery, weight loss strategies, different approaches. Go right ahead. So just chat. You have me for the next 15, 20 minutes. You can chat about whatever you want. So let's do this. I'm going to put the lights on here. And then let's do this. All right, guys. Okay, so we're doing an Ask Me Anything about medications, weight loss surgery, drugs. A lot of times people ask me about various diets. So just go ahead and ask your comments. Okay. So we've gone live. I'm going to wait for some people to fill in the stream, and then we'll get going. Okay, we're gonna get going. All right. So we already got a question. So just type in your questions. All right. So we got big rocks from starting to make progress. Okay, here's the question. What's that look like? Big rocks from starting to make progress. What does that look like? That's a great question, man. What does that look like? It looks great, man. It looks great. Okay, so let's go and get to another question here. All right, so we have Teresa Mealy. Okay, spent 4 days in the hospital with a large kidney stone. Okay, emergency stent in place. Everyone saying eating meat causes kidney stones. Okay, any weight loss strategy will cause kidney stones. Any weight loss strategy will cause kidney stones. So if you look at data from gastric bypass, certain medications, they all seem to cause kidney stones. A low carbohydrate diet specifically causes kidney stones because it increases urinary sodium and magnesium. Okay, and with that, sometimes urinary calcium also increases. So, we do see an increased risk. And to mitigate those risks, we often tell patients, one, to liberally add salt and magnesium, but also drink water till your pee is clear. So I'm sorry to hear that. I'm sorry to hear you're going through that, and hopefully you get over it. So yes, there is a increased risk of kidney stones with any weight loss, but particularly low carb. And so we tell people to, basically drink water until your pee is clear. You want nice dilute urine. And then the other thing we tell them to do is, sometimes basically replace the salt and the magnesium. Okay. So I'm sorry to hear that. I'm sorry to hear that. Okay. So we're going to go how to get parents moving. Put them in the car. Put them in the car. Okay. How low carb do you recommend when going into maintenance mode? Usually like 30 to 50 grams, excluding vegetables and, fruit. So like low carb fruit, usually we say 30 to 50 grams, whatever somebody can tolerate. It depends on athlete. If you're an athlete, depends on kind of what you're, where you are. But that's a great question. It's really variable, independently variable. It depends on your insulin resistance. For me, it happens to be 30 to 50 grams of carbs, excluding vegetables. I don't even count vegetables, green leafy vegetables. Okay. How do you manage so many remote scales? We have staff, ourselves and staff, and we have we've created an algorithm to isolate, distressing patterns. So we're in this. Okay. This is a great question here from Sergio. Doc, what is the best tip to cut cravings when transitioning from carbs to low carb diet? We replace foods people cannot restrict with a lower carb version. So if you need the ice cream, we replace the ice cream. You need the cookies, we replace the cookies. So you have a way to deal with those cravings. And then the ideal would be transitioning to real food. Okay. The ideal would be transitioning to real food. Okay, here's the question here From Brenda, monk fruit says it's a sugar alcohol. Is it terrible to ingest and only if desperate? The way we treat sugar sweeteners, look, they're all devised. All these sweeteners are devised to make you eat more. Bottom line, right? That's why the keto treats have them in it, right? And that's why they're using Diet Coke. You wouldn't drink Diet Coke if it didn't have sweetener. You wouldn't sit there and put caramel color and carbonated water into your, drink and eat it, right? It's that sweetener that makes you drink that. So I think my honest opinion is the less sweetener, the better. But I'll tell you this, if, there's a lot of ways to use it. If it helps you get off ice cream, to have some heavy cream, ice cream that you make yourself with monk fruit, or if it helps you get off cookies, to make a cookie with monk fruit, that's a win, right? So I think it really depends, but ideally, I think we've seen enough data that hyperinsulinemia seems to be worsened from the sweeteners over a long term. So I think there's some signals here that are probably not good. There's some evidence that they're not good for the microbiome. It's not like, overwhelming evidence to stop them now. I do use them personally. We don't recommend abstaining from them initially. Coming off of soda to diet soda, that's a win. Okay, but it's I think it's definitely individual. Eventually, we like getting people to eat real food. So I hope that answers your question. Okay, let's see. We got a follower here, Amro Radwan. Okay, hi, doctor. Longtime follower. I eat once a day, low carb. I've been stuck at the same weight for the past 6 to 10 months. Okay, I'm not gaining, but I'm also not losing. I'm working out 3 times a week. Sorry. So if you're pushing down the carb lever, you're pushing down the intermittent fasting lever, then we'd go to the added fat lever. Are you adding nut butters, nuts, cheese, heavy cream? And if that's not the case, if you've addressed those added fats, not saying go low fat, enjoy your salmon, your eggs, right? But if you're adding fat, cheese, olive oil, heavy cream, butter to everything, I'd ask you to maybe just reevaluate that. Okay. And and then if that doesn't work, maybe dial up the exercise. So you have other levers besides the kind of the carbohydrate lever. And we have like a little kind of infographic here. Maybe let me see if I could share my screen. So here it is. We have our 5 levers. Basically, if you've pressed the carbohydrate lever down and you've addressed your meal frequency, then, and you're still not losing the weight you want, then you want to consider reducing added fats. And that's a nuanced opinion, and it's a long discussion. I'm not telling you to go low fat. And if that doesn't work, you've done that, well, maybe, at that point, if your appetite's controlled, leverage up some exercise, right? Leverage up the exercise. It still doesn't work. Maybe you can go back to trying some extended fast. So I hope that was helpful. Okay, so let's see. Quick. Okay, question. Simple question. How am I doing? Okay, how am I doing? I'm still healing. My hand's not better. I had neck surgery. My hand's not better. This is my left hand here. My right hand, you see the atrophy? I can't even raise it more than that, right? So you see the atrophy? Can't even raise it more than that. So I'm slowly getting better. I'm slowly getting better here. Okay. We do not treat over. We can offer our health coaches, licensed through ACE, can work with you all over the country. But if you want medical attention, we're licensed in New York, New Jersey, Connecticut. We have some emergency licenses because of COVID in some other states. Right now, we're seeking out licenses imminently in some other states, including Texas, Pennsylvania, Massachusetts. So that's pending. So I hope that answers that. Okay. All right. Here's a question. I eat meat but prefer a plant-based diet. I'm 80 pounds overweight. Can keto work being more plant-based than meat? Yeah, absolutely. You can eat pretty much as much green leafy vegetables as you want, as much low-carb fruit as you'd like, and still be keto. Okay, you could still be keto. I mean, I would not abstain from eating fish, meat, eggs, but yeah, you can incorporate pretty much as much green leafy vegetables as you want. So I hope that was helpful to you, Michael. Okay, can I be successful in low carb without counting macros? I don't count any macros. Let me give you a simple tool. If it's meat, fish, chicken, eggs, Greek yogurt, you really don't need to count anything. Okay. I don't even count green leafy vegetables, right? I don't even count green leafy vegetables. If you go to the only things I count are nuts, fake foods like the Cello Wisps and the protein chips and the protein bars and the protein shakes and the fat bombs. I would count those nuts, fake foods, and fruit. That's the only things I would really count. So yeah, a lot of people, can be successful without counting. How are you coping with COVID stress? Okay, I'm bonding with my family. I'm exercising what I can. I can get on the bike, stationary bike, and move the bike. I'm doing that. I'm doing my physical therapy. I pray daily, meditate. I try to meditate, but pray daily, and I spend time with my family. That's how I'm dealing with this. Let's see. Okay, here we got another question. Look, I can't answer these medical questions. You guys have asked me medical questions. Somebody has Crohn's. Somebody's predisposed to diabetes on genetic testing. Somebody has a GFR 47, which means their kidney function is low. I can't answer these questions directly, so I can't give you medical advice, but I can tell you weight loss, lowering your blood pressure, improving your diabetes will typically help the kidney situation. Here's a question from Yasir. Can a type 1 diabetic fast 16 hours on low carb, high fat, medium protein without fear of hypoglycemia? It depends on insulin. This is not medical advice to you, but it depends on insulin, right? If you're an insulin, we adjust the insulin on day one, okay, to about 30 to 50% of the basal dose for our type 1. This is not medical advice for you, okay? We watch blood sugars very closely, okay, with CGMs and remote monitoring. So, we work very closely with our patients to adjust insulin. But a lot of our type 1 patients like low carb eating because they don't get hypoglycemia because they're not giving a ton of insulin. Okay, so not medical advice. Got to remind you about that. Okay. Do you recommend fasting 3 to 5 days for high insulin? I'd hit some other levers first. I'd hit, lowering the carbs, lowering the meal frequency, lowering the added fats, then exercise. Then I'd consider added fats like we just showed. All right. We got some COVID questions. Okay. COVID questions from another fellow physician here, Dr. Fauci. I don't watch the news, so I don't really know much what he says. Don't watch the news, so I don't know much what he says, but I'm paying attention to what the CDC says and what kind of other medical news outlets are reporting. JAMA, New England Journal of Medicine. Don't really watch what he says. All right. Let's see. Okay, what exactly makes Dr. Naiman so awesome? Well, I'll tell you this: 1, he's ripped. 2, he could do a one-handed pull-up. 3, I think he's got the right idea with satiety and the protein energy ratio that Dr. Naiman has. I think it hits the spot after you've adapted to a low-carb diet. I think his approach definitely hits the spot. So that's what makes Ted Naiman awesome, is that, I got to say he's like 99.99% right. So that's what makes him awesome. And he's ripped, man. It's like, I got to, it's just what is there not to like? So what is there not to like about Ted Naiman? All right. So let's see. Do not block Ted Naiman, Adam. Okay. Do not block. This guy is like a wealth of information. Okay. One of the best follows. If you come into my office, okay, just so you know, if you come into my office, we got a lot of screens in the rooms, and there's a TV in the front and a big flat screen in my office, and all the rooms have flat screens, and his infographics are the screensaver. Okay, so his infographics are the screensaver in my office. So that's what makes Ted Naiman awesome. Okay, so that's what makes him awesome. All right, here we go. We got another question here. When do you use fasting insulin versus C-peptide? They're both helpful. They kind of say the same thing. They're a little bit different. So that's a great question. I think that's actually a great question. I think particularly maybe in type 1.5 diabetes, you'd consider C-peptide use. I think in some, if you're trying to ascertain kind of the function of the pancreas. I think that there's some minor useful uses for it, but largely most of it you can tell just from the insulin. That's a great question, man. This has got to be a physician, probably a physician here. Okay, here we go. All right, Alice Lee Williams, keto 2 years, mostly carnivore for 5 months. Initially lost 60 pounds. Have been at the same weight for a year and a half. Need to lose another 40 and stuck. Okay, we just did that. We just did our 5 levers. Okay, we just did our 5 levers. All right. Okay, we did our 5 levers. I'm going to show you real quick so you see it one more time, and maybe we'll put this out on the website. I'm not really sure right now, but if you guys all see this, here's the 5 levers. Okay, first the carbs, then the meal frequency. Okay, if you've done those, then it's reducing the added fats. Okay, if you've done that, then it's exercise. If you've done that and it's been months, I'm talking about months, then consider the extended fast. That's our general approach to low carb and IF. Okay, so that's our general approach. Can you guys see me now? Hopefully you can see me. Hopefully you can see me. All right, guys, I'm gonna wrap it up pretty soon. Let's see. Here we go. Okay, there's a question, comment on. I don't really know if this is a question. So, all right, guys, I'm gonna give you 2 more minutes for last questions, and I'm gonna call it quits and go home and see my family. So, any last minute questions coming in, I'm more than happy to answer them. We have people from YouTube. We have people from Twitter. We have people from Facebook. Here we go. Here's a question I missed before. How about IBS and carnivore? It is not cleared up for me. Very painful, almost to hospital many times. Both IBS C and D, by the way, have had this for years, not just since keto carnivore. If I have patients with bowel issues, so again, this is not medical advice. If I have patients with bowel issues, okay, look, if I have patients with bowel issues, usually I'm recommending not restricting fiber, or if they know they can tolerate fiber, certainly not restricting it. And then I typically recommend magnesium just to keep it regular. So if I see huge bowel issues, history of diverticulitis, that's my general recommendation is, if they're good with the plants, like the plant food, go to town on the plant food, and magnesium. That's the other one. Here's a question. Best way to prevent AFib on keto. So not a lot of studies for AFib prevention, not so much data on AFib and keto particularly, but in general, weight loss has been shown to prevent weight loss has been shown to prevent atrial fibrillation, okay, to help with the symptoms of atrial fibrillation. Weight loss in general can limit the symptoms of atrial fibrillation. And theoretically, magnesium supplementation, theoretically. So these are the 2 things we recommend for our patients most of the time who are coming to our practice. This is not medical advice. I'm going to reiterate that. Okay, weight loss and magnesium seem to be somewhat helpful for AFib. There's some data that shows that these 2 are helpful, but this is not medical advice, and you got to talk to your cardiologist and your doctor. Okay, guys, I'm going to wrap it up. Thank you for joining me, and I hope this was helpful. I'll be trying to do more of these.